Many people over 50 are told, "Your back hurts because your spine is damaged." But for a large number of seniors, the main problem is not a broken spine. It is weak, poorly coordinated muscles around a spine that simply shows normal signs of aging. This script will help your viewers understand when back pain is more about muscle weakness and loss of control than about something terribly wrong on the scan, so they can fear less and focus on the right solutions. You have probably seen this with friends, or maybe in your own family. One person has an MRI report that sounds awful: disc degeneration, bulges, arthritis in the joints of the spine. Yet they say, "My back bothers me sometimes, but I manage." Another person has a report that sounds only mildly changed, but they can barely stand or walk without pain. It is easy to assume that the worst scan must mean the worst pain. But large studies in older adults show something surprising. Many common degenerative findings on spine imaging, disc wear, bulging, joint arthritis, appear in up to 80 to 90% of people over 60 who have no back pain at all. In other words, the picture often looks bad even when the person feels okay. So if the picture can look bad and the person can feel fine, what else is going on? One big part of the answer is the condition of the muscles and control system around the spine. Muscle deconditioning, when the back and core muscles are too weak or too tired to support you well, is now recognized as one of the most common contributors to chronic back pain. It is not just how your spine looks on a scan, it is how prepared your body is to use that spine. My name is Dr. Robert Ellis. For more than 20 years in geriatrics, there have been many older adults with scary-sounding MRI reports who walk into the clinic and say, "I hurt, but I am still going." There have also been people with only mild changes on imaging who can barely get out of a chair without help. Over time, it became very clear. Imaging is only one piece of the puzzle, and muscle weakness, poor endurance, and loss of control often explain the gap between what we see on the scan and what you feel in your daily life. The system around you, however, often sends a different message. You have pain, you get an X-ray or MRI, the report lists a long paragraph of degeneration, and you are told, "Well, that is your back. What do you expect at your age?" It can sound final, almost like a sentence. Very little time is spent explaining that many of those findings are also present in people your age with no pain at all, or that how strong and coordinated your muscles are can change your pain even if the scan stays the same. There is a systemic enemy here, and it is not the technology or the doctors. It is the myth that pain equals damage, and that the only story your back has to tell is the story on the image. That myth leads many older adults to avoid movement, to fear exercise, and to believe that if something hurts when they try to get stronger, they must be making the damage worse. Over time, this belief can quietly rob the spine of the very support it needs. Underneath this myth lies a hidden condition that does not show up on a scan: muscle-driven back pain from weakness, fatigue, and loss of control. This is not about being lazy. It is about what happens to living tissue when pain, fear, and aging all push you toward moving less. Over months and years, if you move less, Because of pain or fear, several things change. The deep muscles that stabilize your spine shrink and lose endurance. Your hips and gluteal muscles weaken. Your balance and timing get a little slower. When you then ask your body to do something simple, stand in line, carry groceries, walk across a parking lot, the muscles cannot share the load the way they used to. Your joints and discs feel every step more sharply. Research in different groups, including adults and athletes, shows that poor core endurance, not necessarily huge weakness, but the inability of your trunk muscles to keep working steadily, is closely associated with more back pain and more difficulty doing daily tasks. Other work in seniors with low back pain highlights that physical deconditioning, loss of strength, endurance, and control is a major player in why pain becomes chronic, even when scans do not look terrible. In simple language, your spine may be aging on the inside, like almost everyone's over 60. But how much that aging bothers you depends a great deal on how awake, strong, and coordinated your muscles are. This is where the story becomes hopeful instead of hopeless. If your pain were only about damage on the picture, you would be stuck waiting for the picture to somehow change. But if part of your pain is coming from muscle weakness and loss of control, then you have room to act. Muscles and movement patterns can be trained, even in your 60s, 70s, and beyond, with the right kind of exercise. In the rest of this video, 3 main areas will be laid out. How to tell when pain is more likely driven by structural problems that need careful medical attention, when it is more likely linked to deconditioning and muscle weakness, and what you can do about that second category. You will see why 2 people with the same MRI can feel so different, and how that knowledge can help you fear less and move more wisely instead of giving up. Strategy 1. Understand what imaging can and cannot tell you. Lowest impact, biggest mental shift. Mechanism imaging. X-rays, CT scans, MRIs. Shows structure, bones, discs, joints. It does not show pain, and it does not show muscle endurance or control. Studies that looked at imaging in people with no back pain found that degenerative changes, disc wear, bulging, joint arthritis, appear in a very high percentage of people over 60 who feel fine. In some reviews, disc degeneration and signal loss were found in nearly 90% of individuals, 60 and older, with no back symptoms. That means that many abnormalities described on your report may be part of normal aging, like wrinkles on the skin. They can be present, but not necessarily the cause of your pain. On the other hand, some serious findings, like certain fractures, infections, or tumors, are rare, but very important. Those are the situations where imaging and symptoms must be taken very seriously together. Study. A large meta-analysis of spinal imaging found that common signs of degeneration are present in high proportions of people without pain and increase steadily with age. Clinical guidance for back pain in older adults now emphasizes that imaging findings should always be interpreted in the context of your symptoms, your function, and your physical examination, not in isolation. Daily life relevance. For you, this means if you have a scary-sounding report, but your doctor says your exam is stable and there are no red flags, like sudden weakness, loss of bladder control, unexplained fever, or weight loss, there is a good chance that at least some of what you see on the paper is normal aging. Your pain is real, but it may be more about how your body is working than about an emergency in your spine. On the other hand, if you have new, intense pain with serious symptoms, that is not something to ignore. That is when imaging, medical evaluation, and sometimes more urgent treatment are needed. The goal here is not to tell you it is all in your head, but to show that the report alone does not get the last word on your future. Strategy 2. Recognize the signs of muscle-driven back pain. Medium impact mechanism muscle-driven back pain often shows up when your back and hip muscles are too weak or too easily fatigued to support you. You may be able to sit or rest with only mild discomfort, but as soon as you stand, walk, or try to carry something, your back starts to ache, tighten, or feel shaky. This is your body saying the support team is not keeping up. Common patterns include pain that increases the longer you stand or walk and eases when you sit or lean on something, a feeling of heaviness or burning in the lower back after simple tasks, like washing dishes, making the bed, or standing in line. Difficulty holding your posture upright. You drift into a slouched position because the muscles tire quickly. Studies on people with low back pain often find reduced trunk endurance, the ability to hold a gentle contraction over time compared to people without pain. Other research points out that physical fitness and muscle conditioning are often lower in chronic low back pain patients, and this deconditioning can be both a result of pain and a contributor to keeping it going. Daily life relevance. If you notice that your back complains more during activity than at rest, that you feel wiped out in your back after modest standing or walking, or that your legs and core tire quickly, muscle weakness and loss of endurance are very likely part of your problem. This does not mean your spine is fine. You may still have arthritis or disc changes, but it means that focusing only on the scan and not on rebuilding your muscle support would miss a big opportunity. Strategy 3. Use targeted, gentle training to change the story. Highest impact mechanism. The most important practical point is this. If muscle weakness and control are part of your pain, they are also part of your solution. Core strengthening and stability exercises, when introduced gently and appropriately for your age and condition, have been shown to improve function and reduce disability in people with non-specific low back pain. General strengthening and endurance training also help prevent further deconditioning and can make everyday tasks easier. This does not mean doing sit-ups or heavy gym workouts. It usually starts with simple moves, like sit-to-stands from a chair to train your legs and hips, gentle core stability exercises such as bird dog variations or pelvic tilts to wake up the deep trunk muscles. Short, regular walks to re-educate your body that movement is safe and builds stamina. Study research has shown that programs focusing on core endurance and control can reduce back dysfunction, and that core strengthening exercises can improve functional disability scores in people with chronic low back pain. Clinical articles also highlight muscle deconditioning as one of the common, modifiable causes of chronic back pain, particularly in older adults who have reduced their activity over time. Daily life relevance. In your daily life, this kind of training aims to change things like how far you can walk before your back starts to complain, how easily you can get in and out of chairs or cars, how steady you feel when you bend, twist, or reach. When the muscles that support your spine get stronger and can work longer, the same old joints and discs can hurt less under the same daily loads. Your MRI might not change, but your experience of your back can. From less fear to more independence. Understanding the difference between structural damage only and muscle weakness and control is not just an academic point. It changes your future. If you believe your pain is only about damage, you may avoid movement, rely more on medications, and slowly lose strength, balance, and confidence. Over time, that can shrink your world. Fewer walks, fewer outings, more dependence on others. If you understand that muscle weakness can be a major cause, you gain something precious, a sense of agency. You still respect your pain and your scan, but you also see room to act. With support from your doctor or physical therapist, you can build a small, realistic program that fits your age and health, and that builds you up instead of scaring you. Better muscle endurance and control are not just about pain scores. They are about independence, staying steady on your feet, preventing falls, climbing stairs, carrying groceries, and living where and how you want for as long as possible. The same exercises that help your back hurt less can help your heart, your balance, and your confidence. Who you are is not your MRI report. It is easy, after reading a long list of findings, to think, I am my bad back. But you are not a piece of paper. You are not a scan result. You are a person with history, habits, strengths, and choices. You also do not need to see yourself as a fitness person to work on this. You do not need to join a gym or love exercise. You simply need to see yourself as someone who is willing to give their muscles and their spine a bit of training so that they can support the life you care about. Instead of, my spine is wrecked, nothing will help, a more helpful and more accurate story might be, my spine shows age like most people my age, and my muscles and movement can either make that better or worse. I choose to help them help me. That shift in identity from passive patient to active partner is one of the most powerful changes seen in older adults who do well. A gentle invitation and close. If this video helped you see the difference between back pain from pure structural damage and back pain made worse by muscle weakness and loss of control, let it guide your next step. Ask your doctor or physical therapist not only, what does my MRI show, but also, what can I do to improve my strength, endurance, and control safely at my age? You do not have to do everything at once. You might start with a short daily walk, or a few sit-to-stands from a chair, or a very gentle core exercise. The important thing is that you stop treating your scan as the end of the story and start treating your muscles as part of the solution. This is Dr. Robert Ellis. If this way of thinking about back pain as more than just bad bones made sense to you and gave you a bit of hope, consider liking this video and subscribing to the channel. It helps more people over 50 find clear, compassionate information that helps them move from fear toward action. You are not too old to get a little stronger. You are not too far gone to improve your control. You are simply at a point in life where understanding what really causes your back pain can help you spend less time worrying about pictures and more time building the support your spine has been asking for.